So I'm a big believer that prevention is way better than cure. And a lot of what I do in my practice is preventative medicine. So I look at things like blood tests on a routine basis for your general health, like your blood count, kidney function, liver function, cholesterol, and sugars when someone doesn't have any symptoms. And I think it's a really good idea to do testing like this every year to 18 months. So if something is cropping up in your health, it's picked up earlier. And the earlier we pick up things, the better we can treat it so it doesn't become like a major problem. Other things I recommend for women are things like mammograms, probably from your 40s onwards, at least every couple of years. And the NHS screens you from the age of 50 every 3 years, but that you can get breast cancer earlier. And I think it's well worthwhile getting a check if that's within your reach every few years. And also an ultrasound of the womb and the ovaries to pick up any abnormalities on the ovaries or in the womb. Other things I like to do with my patients is advise things like continuous glucose monitoring to make sure blood sugars are stable, and things like the Zoe study are also very useful for monitoring sugars. And I also do vitamin and mineral testing so that you can optimize the supplements you're taking or change your nutrition based on what you're absorbing and what you're low in or what your levels are good in. Then you don't need to take those supplements. And also I look at things like gene markers to see what are you prone to genetically, and then what do we need to change in your lifestyle or supplements or test on a regular basis. And this could be looking for inflammation, issues with heart health, breast cancer risk, also looking at, in terms of diet, what your body responds best to genetically. So having this sort of information, I don't think is scary. I think it's a really positive thing to help you make good changes in your lifestyle and your diet.